Good evening, everyone. It's 4 p.m. Mumbai time, and I'm your host, Dr. Suhani Mendonsa, and I welcome you all for this wonderful panel discussion with eminent doctors who are with me. In fact, it's my honor. Today, I'd like to sing one line for y'all because Women's Day is approaching. बादल पे पाँव है अब छोटा गाँव है अब तो ये चल पड़ी अपनी ये नाव है. I think all the women who are present here will definitely agree with me that women are strong and much stronger than what anyone can perceive or think that they are, right? Well, a very, very warm welcome to our eminent panelists that we have with us. We have got Dr. Swati Kshirsagar, Dr. Shilpa Desai, and Dr. Prachi Ambolkar. A warm welcome to each and every one to you. Hello, hello, hello.
Hello. Thank you so much, Dr. Suhani, for having all of us here on the same platform.
Absolutely. Yeah, so we have got Dr. Prachi Ambolkar, who's a clinical dietitian and a life-saving skills trainer. We've got Dr. Swati Kshirsagar, who is indeed a MBBS, MD, a radiologist, and the founder of Precision Diagnostic Center. And yes, we have got Dr. Shilpa Desai, who is indeed the MD and founder of C4 Wellness Center, a wellness expert, and she is also a PhD in health psychology. And she's the wellness center which she has is a center which everyone must visit. Well, a warm, warm welcome to all of you and to all our wonderful viewers who are watching us here live today. Well, before I start, I would request each of my eminent panelists to further introduce themselves. So, if I may request Dr. Prachi Ambolkar to introduce herself first and tell us more about what all she's been doing.
So, once again, thank you, Dr. Suhani, for having us here. It's a pleasure being here on this Women's Day. And hi, Krish. Yeah. So, yes, I'm a practicing clinical dietitian practicing in Navi Mumbai, one of the top 5 diet consultants in Navi Mumbai. And speaking about myself, my youngest clientele is from a 9 months old baby to a 67 years old lady. So that's the range of clients or the age group that we address as dietitians. And I'm also the author of one of the ebooks available on Amazon, which is 21 tips for a healthy diet, which is available on Amazon, the worldwide platform for sale. And also my international clients are from countries like USA, UK, Qatar, then Dubai and France. These are a few countries where I'm consulting online right now. And yes, it's an amazing time because a lot of people post COVID have become very health conscious, and they are COVID. I know we have all gone through a lot, but still I'm meeting people or clients who are actually pushed to be health conscious. A lot of their lifespan where they have not really bothered to take care of their health. But yes, I'm sure that these days a lot of people have health as their priority, I think, which is amazing. And as a life-saving skills trainer, I've trained the crew of NASA, trained for life-saving skills, like when someone collapses, how to save their life till the ambulance arrives or help arrives, or that person reaches to the hospital. Also, I've trained more than 5,000 doctors, paramedics, and laymen. And apart from these, done some nutrition talks in corporates like Hindustan Coca-Cola Beverages, then Rosy Blue Diamonds, GP Solutions, and many more. And there are some amazing projects like where I really enjoy doing, going to the schools and uh, throwing some insights about nutrition, about nutritious meals to the parents as well as children. So we did an amazing uh, a project which was Khausa Daba, named as Khausa Daba with Sakar newspaper. And this was for all the schools in Navi Mumbai, Thane, where we spoke about the importance of how they can, because the parents are working, how they can include nutritious meals in their lunch boxes. Yeah. So that's it. Thank you. Thank you so much, Dr. Suhani.
Thank you
I
so
think
much, Dr. Prachi. That was absolutely brilliant. Great to know. Make it full screen. If I may now request If I may now request Dr. Swati Kshirsagar to kindly let us know more about the wonderful work that she is doing, and she is extremely passionate about breast cancer too. So, Dr. Swati, please, if you may go next, please. Uh, should I
Yeah,
start your presentation?
yeah, please, you can.
Yeah.
So, good evening, all. First of all, let me wish all the wonderful women here present on the panel and those who are watching us a very happy International Women's Day. So, we actually celebrate womanhood every day. And now, talking about myself, I am Dr. Swati Kshirsagar. I am an MBBS MD radiologist from Mumbai, practicing for more than 20 years. And I've seen thousands and millions of patients so far. And my specialization is women's imaging. So, what exactly means women's imaging? My modality is mainly ultrasonography. So, ultrasonography is now no more a basic modality, but it has become now an advanced super specialty. And just to few of my achievements would be the international fellowships which I have obtained in these years. The first one, this one is in the fetal medicine, that is the pregnancy related scans. I have done an advanced fellowship in genetic scans, in gynecology imaging. Next one, please. This was in infertility imaging in women.
Right.
Next one, please. And this one was the fellowship for the performing scans for the unborn baby's heart. So these are
Right.
the few of the additional fellowships which I have obtained apart from my basic qualification. And talking about women's imaging, it is not only limited to pregnancy scan, it is all the complete, all the organs, including the breast up to the uterus and to the unborn baby. Everything is covered. And as Dr. Suhani rightly said, my passion when we are talking today, I would definitely like to take the advantage of this platform to create awareness about the breast cancer. Now, today, when we are here on this panel, on this wonderful event, specially organized, keeping in mind about the women empowerment, I
Right.
firstly and I would like to recommend here that when we talk about the empowerment, the first and the foremost important thing is the women, all the women, they are the pillar of their individual families. So, if you really have to take care of your family well, first you have to start taking good care of yourself. And for that, first you have to take good care of your health. So if you are in a good health, you can definitely take better care of the others who are dependent upon you, like your husband or your kids or what. So breast cancer is something that generally it is the most ignored and the most neglected part. Even when we talk about the corporate checkups or the annual checkups, people generally talk only about the pathology, or and the at the most they will go for the abdominal scans. But they are so scared of the breast cancer that they generally want to avoid, and they feel that only if there is any indication, why should I go for breast cancer when I don't have any family history? But that is not so. Now, just to talk about little statistics about breast cancer, in USA, the incidence of breast cancer is 1 out of 8 women, whereas in India, specifically in Mumbai, if we talk about the statistics, it's around 1 out of 29. Now, is this something we should feel happy about it that the incidence is really low as compared to USA? So it's not so, because in USA, almost all the women above the age of 40 they are screened for their breast cancer. So the detection rate is much higher as compared to in India. And unfortunately, in India, people come forward for this mammography, which we call the for the breast
Right.
cancer, the examination we
Right.
call mammography. They come only when they are having some problem, some lump, and that's why unfortunately they generally present when the
Mm.
stage is already of 3 and 4. That means in advanced stage, where actually there is some limited treatment we can offer to them. But if a routine screening is taking place for all the women who are above the age of 40, then the detection rate would be much higher. The incidence also will be higher. But at the same time, the treatment and the cure rate and the survival rate post treatment is going to be much, much higher. So I am on a mission to create awareness about breast cancer by offering mammography, which is a breast examination by screening, wherein we do X-ray of the breast and a complementary ultrasound also. So I'm really on a mission. I really want to create this awareness, how to do the self examination, what would be the warning signs and symptoms. If
Mm.
so, what should be done, which are the doctors they should be consulting to, and if they are having any myths about it, if there are any positive family histories, what exactly the other deviation would be from this protocol. So I'm on this mission, and I would really urge all the women to first
Mm.
take care of all these things. And if you are healthy, you can have healthy families and you can create healthy nation.
Thank you so much, Dr. Swati. That was indeed very, very insightful and very, very required, and the need of the hour for everyone to know about this. Thank you very much. If I may now request Dr. Shilpa Desai to kindly please do. Uh,
Yeah, I'm here. I can
Sorry,
hear
yes,
you very well.
yeah, Dr. Shilpa, yes.
Yeah.
I
So,
thought for a second I lost
no.
you.
Thank you so much, Suhani, to have me here. And it was so nice to hear Prachi what she's doing. Amazing thing. And I know, of course, Swati, she is so passionate and she's so focused. And one of the wonderful doctor I have been ever known, and Dr. Swati is among them. And I really wish that we work together many projects on where we have the same insight, and
Yeah.
definitely it's all we work, so it's all togetherness. And Suhani, of course, you are like, एक मोती होती है लेकिन उसको एक माला की जरूरत होती है.
Oh, sweet.
So there has to be see what I'm wearing, this is what you are.
Yeah.
So, so this is
So nice.
Swati, this is Prachi, this is Khushbu, this is Pavan.
So nice.
So we all are
So,
together.
right.
And
Mm,
okay, my introduction is, as
yeah,
Suhani has given a little bit about me, and
yeah.
I'm running a C4 Integrated Wellness Private Limited at Kafparid and Juhu, and we have wellness state of art and scientifically backed system of wellness we have. In wellness, like C1, it is C4. It means the complete concept of care to cure. C1, we have all the disease management, weight loss, diabetes, PCOD, PCOS, hormonal issues, and if you say the endocrine conditions there, then if you see that cancer management, palliative care, we do that all in C1. C2
Mm,
is physiotherapy and pain management, sports management, injury management. Here we have an orthopedic surgeon, doctors, physiotherapists, sports specialist, musculoskeletal specialist on board with us, and they are my staff also. C3 is an aesthetic, where we do like all the aesthetic treatment we do here. We do PRP, we do microneedling, vitamin C, and scar removing. Then you pigmentation, everything. So that is also ULIPO we have there, where weight loss also we take care with the other instruments. We use it and we reach to the goal what we need to. Then C4 is all about the DNA research and development. And then we do the DNA reports there, diagnostics are there. And then we have mental health management, which is in education, wellness also, we do this in a big way. So this is how my C4 work. And we are into nutraceutical. And in nutraceutical, we have D3, B12 therapeutic weight loss programs. So this kind of complete holistic program of wellness we bring.
Right.
And we do projects for the governments, also SRPF, Maharashtra State Police, and we work for the club, Goregaon Sports Club, Celebration Club, MCA also. My doctors are working there for their matches and all. So this is how the C4 is trying to, help people and to give them the best of the happiness through their wellness and their good health.
Thank you. Thank you so much, Dr. Shilpa. That was lovely. We would like to play your video now. If you could just give us
Yeah,
a minute, we will play your video.
sure.
Just a second.
Yes, Suhani, now it's okay. Yeah. I can't hear you, Suhani.
Sorry,
Suhani, we
sorry. I
can't
was
hear
unmute.
you.
Yeah. Can you hear me now, please?
Yeah,
Yes,
yeah,
yes,
very
yes.
much, very much.
Thank you, Dr. Shilpa. And indeed, that was amazing work that you're doing in the field of wellness, and we can see the amount of passion that you have for it. That was absolutely great. So, all these wonderful women that eminent doctors that we have with us today. First of all, I'd like to salute each one of you all because in your field. We are doing such brilliant, y'all are doing such brilliant work, and it's really great to see that each of y'all have got this yearning to do something for your women tribe, to do something for them too. And it's really wonderful. So my it is something which I would really like to ask all you wonderful women out here is, and to share your views on it is, we always say that women are very strong. Women are the only ones who can multitask. Women are the only ones who can do whatever they want to. But at the same time, they are facing so many issues. Either it is if the family issues that they are facing, or if they are, belonging to villages, then they have, certain rituals, certain traditionals which bind them, and they don't let them, be themselves. So, would like to know what is it that you, as an individual, as a woman, would like to do for them? So, if I may first start with Dr. Swati, if you could tell us, please, your views.
Yeah. First and foremost important is we don't require any empowerment. We are already empowered. So we don't. What we need mainly is the encouragement. That I feel. First of all, nobody should consider women as any goddess, and please don't in a pedestal. Just treat us
Yeah,
like human beings. And what we actually only expect is
Mm,
respect, and
right.
just to
absolutely.
treat us just like any other human being. So when they talk about multitasking and all these things,
Mm.
It's not necessary that every woman should be doing it. So
Mm.
failure and mistakes, this is part of everyone, every individual's life, and they should also be respected. If one particular woman is
Mm.
not fond of cooking, or the uh, casually called as the
Mm.
woman should be good at so many things, and the
Right.
particular cooking and a mother
Yes.
and all those,
Yeah.
it is not needed for every woman to be like that. Some may be entrepreneurs, some may be just like to be homemakers, but all these roles should be taken up by them by choice, by their own choice. It should not be forced upon them. First and most important thing. And secondly, what I have realized is when women have actually getting educated, and when they want to work, and when we talk about the gender equality, unfortunately, what is happened that they are allowed to go out and work, but at the same time, what equality would have expected is the spouse should share the responsibilities at the domestic level also, like taking care of the family and the kitchen work and all those things, which is not happening. So when in trying hard to get
Right.
that freedom of getting educated and going out and working, I thought what we are losing out is that probably now they have put us in a, they have given a very nice name of multitasking, and then they say
Yeah.
that you are good at it, so you should be able to perform everything, which I feel that it's a very smart move, which is made by men. And I keep telling this to my husband also. He's also a
Yeah.
doctor, radiologist. So I said, when I
Right.
work out, when we both go out and work, so when we
Right.
come back, the responsibilities at work, at home also should be shared. So I feel
Yeah.
that everywhere, whether it is not only the spouse but all the family members, whether in-laws or not, a woman
Right.
should be respected. And it's not that only when they're working and going out and earning money only then. So it should be
Right.
just given a choice to them what they want, if by choice if they want to. And as you mentioned, it is not
Right.
that only uneducated and underprivileged women who are not getting the opportunities, but even in the good class of families also, rich families also, people don't have the women, they don't have the freedom of expressing their views and ideas, or even uh, to go out and work also.
Correct.
So I
Correct.
feel that every woman should stand for her own this thing choice,
Mm.
and at the same time then they should be willing to risk the comforts also, which they
Yes.
otherwise get. So if you really want to be self independent, first don't be dependent upon anyone else for
Right.
the financial also and for other things also. And at the same time, I would just like to say this also, that when we are trying so hard about women empowerment and about respecting women, at the same time the respect to other gender also is equal and important too. So when
Very
God has
true.
created Adam and Eve, we
Yes.
men and women, we are not here to compete with each other, but we are here to complement each other.
Each
This
other.
should be.
Thank you so much, Dr. Swati. I mean, your thoughts were absolutely amazing and very well said. And as you said, that yes, we are here to complement each other, and we are not here to compete with each other or put, anybody down or anything like that. Nobody is. Both of them have to walk together parallelly. So as I always say that in the word woman, men is already there. So if just taking that into consideration, if we all keep that in mind, and if we all work together as one, I think sky is the limit. We can do anything and everything that we want. If I may request now our wonderful dietitian, Dr. Prachi Ambolkar, to give her views, please.
Yes, thank you, Dr. Suhani. I think women empowerment is about women supporting women, women helping women, or helping women grow.
Right.
Because it's also about upbringing of a child, whether it's a girl or a boy. It's a mother, and it's high time that that men are not involved in parenting. I think that's one basic crucial
Yeah.
point that we are missing out. And probably I feel pity for all those men who really literally miss out, who are probably not involved in the parenting, and those early stages which are not going to come back in your life again. So
Right.
I think they are really missing out on this larger aspect of life. Uh, so I feel that women empowerment begins from there. When it comes about raising men or raising. So when we talk about treating, so treat girls and boys equally, like, whether it is wearing clothes or whether it is about coming home at a particular time or about education. So it
Yeah.
should be the same.
Right.
And when as children we say, na, when a girl is sitting like this, we tell her, okay, sit properly. But
Right.
boys are never told that. Or even by, using public toilets. So
Yeah.
boys can just go and pee anywhere.
Anyway, yeah, yeah,
But that's not so. So I think it's high time that even there should be something like men empowerment for on International Men's Day. We should be celebrating that. And uh, yeah, that's what I think. And I feel that if a woman in the form of a mother, if she supports her daughter, whether it
yeah,
is her education, whether when a girl marries and goes to the other house, and if there is some issue or some problem that happens there, then
right,
that girl should has a door to come back to her home. And there, I think a mother has a bigger role to support her daughter.
right.
And yeah, that's what. And I think progress. And I think if with that upbringing, even so, it's all about the upbringing or the parenting. I think that matters at the end of the day.
Right.
For I think that's the basic crux of it.
Yeah. Thank you so much, Dr. Prachi, for your views. I think absolutely what we learn at home. Home is our foundation. Our basic foundation is everything we start. We begin from home. So yes,
People
and
sometimes think that it is the school that will teach our children, but it's
yeah,
not so. It
no,
is the
it's
home where
always
the
yeah.
children take, yeah, they
Absolutely,
rise
very
in.
well said. It is very much home is the basic foundation. They always say if you are at home, you are at your best, then you are going to be the same outside. And yeah, and that's your foundation. That's absolutely your foundation. So very well said. Dr. Shilpa, please maybe know your views.
Yeah. My views are I always support humanity, then support
Right,
any individual as a gender. So
right,
I believe that woman empowerment, the word which we have started, I think I wish that we should change it, and human empowerment day we should keep it now, because uh, we should be very much equal. System equality should be there between the man and woman, and that is why we have started with the women empowerment, where we used
right.
to feel that the woman has not been empowered as the man is. And when we women are talking together in this Mumbai city, and if we talk in Pune, if we talk in Bangalore, and then you just cross the border and you go to the villages and you see the women there. So I feel that the women who are in cities and the women who are already empowered themselves with their education, with their system the way they want it, then their contribution to help others and help other women to upbring themselves there. Not it's not empowering. It's like
Mhm.
how Swati has said, and I agree to Swati also. I agree to
Right.
what Prachi said, that we all have a same wish, and we all want a woman who is actually a mother of a man and so
Yeah.
they are already empowering a man for to empower a woman. So I
Yes. Yes.
always say that if we start from now, if my statistic tell me, we
Yeah.
PhD always work in statistic, and 10 years of work. So, Suhani, if we start this now,
Right.
experimenting that every woman who has a man, they should
Right.
empower a man to give a equality to women, then there
Right.
won't be any kind of empowerment be needed for a woman in future. So I think we are already lot of empowerment we have, and now
Yes.
only the thing is we need to spread an awareness to woman itself to empower a
Right.
man.
Correct. Correct. Very well
Yeah, so
said,
this is what I
Dr.
think.
Shilpa. Very, very, very well said indeed. I think all the three doctors have given such fantastic views. Absolutely brilliant to know your individual viewpoint. So what now? I really want to know. Each of y'all are in different a field of medicine. Okay, we have a radiologist here. We have a dietitian, nutritionist here. We also have Dr. Shilpa who's with wellness. Okay, so now I want to know that through your profession. Okay, what is it that you can do for women to grow, for especially for women to grow, as in a lot of women are like Dr. Swati gave us such a insightful while she was giving an introduction. It was very, very tiny, but she spoke absolutely brilliantly where breast cancer is concerned, and that is the need of the hour, that is really, really required today. So, through your profession, what more is it that you can do in the future, in your future plans that you have? What is it that you can do for our own tribe, that is women? So, Dr. Swati, if we may can start off with you, please.
Yeah, sure. So as I mentioned, that I do the scan, all the scans, but the most
Yeah,
importantly, what I want to work for is a breast cancer awareness programs. So
right.
what I'm already working for, and what I want more and more corporates or other companies, or even for general women also can do is, we conduct workshops for breast cancer awareness, wherein
Mm,
we take only women in that group, because this is having such a social stigma, and women, if they're educated or from very good class, even then
mm,
they don't feel comfortable speaking about these things in front
right,
when, means when the men are around. Okay, so
right,
then we have realized that, and so what we are doing is we conduct breast cancer awareness workshops exclusively for women, where we actually answer all their queries. We teach them self examination, self breast examination. Okay, how to
right,
do it, what is the correct way of doing it, when to do it, and what are the signs and symptoms they should be watching for. So, if any
right,
one of them, if they come across at any given point, every month they should be doing it. So, we actually demonstrate that in front of all the group of women. We make them do it in front of us, and so they have to go back home and they have to do it every month. And when they come
wow,
across any, because see, your body, it is your body, and if you are doing this examination regularly on a monthly basis, you are going to be the first one to notice even the smallest change which is taking place in your body. So once you come across that, then you have to present or go and consult with the doctor. And
mm,
this is there every month. But second most important, what we teach is why they have to get their mammography done every year. See, there are again two types of mammography. We call it screening mammography and diagnostic mammography. So, just to give a small example, we do a
mm,
routine annual health checkup. So, the screening mammography is needs to be done once in a year for all the women above the age of 40 years. But in
okay,
between the two routine health checkups, if we fall sick, or if there is
mm,
any concern, health concern for which we have to get the test repeated. We don't wait for the next annual health checkup, right?
right,
Similarly,
right,
with the two screening mammograms, if there is any cause, after doing the self-examination and after consulting with the doctor, if the doctor feels that there is an requirement for us to repeat the mammography examination and we don't have to wait for the next annual checkup, then that mammography is called diagnostic mammography. So we
right,
explain them everything. If there is any family history, then what are the extra precautions need to be taken. There are so many myths involved, like what kind of innerwear they should be wearing, what should be
right,
avoided,
right,
and all those
right,
things. So many things.
right,
And now,
right,
because of the social media, it is working for, and sometimes it spreads something which is really not necessary, and many a
mm,
times wrong information also. So we have to
correct,
validate all the information which they have been bombarded with on social media. So we actually give them the authentic answers, and which are the actual reliable sources from which they can get this reliable information. So all these things are
fantastic,
really these things are answered, and then they know the importance of it. And if unfortunately if they fall prey to this particular disease, and if it is detected at a very early stage, it can
right,
be cured, and the survival rate is amazing. And
yes,
then the
yeah,
patients which we have been seeing for more than 5 years or 10 years, we share all
right,
those experiences in all those cases, which gives them really confidence in coming. Otherwise, there is so much of anxiety is also involved.
right,
And the most
right,
important thing is, I being a female doctor, when I get
Mm,
any patient, the most important
mm,
thing first I would do is I give a listening ear to them, because there are so many
right.
things when they come, even before they start with their examination,
True.
it's an emotional thing for them which they want to vent out. And they want someone to listen to them, they want to
Yes.
talk about
Yes.
family and
Yes.
kids. So as women, as just a woman and just being an ordinary woman, when I listen to them, and then
Mm,
when I examine them as a doctor, so this is a
doctor.
special kind of bond also which we
Yes.
develop, and I know understand what kind of anxiety having
Mm,
after kids, and when we think about the family and all those things.
right.
So
Yeah.
just you have to be there as a support to them, and not only just
Yeah.
offering just an examination as a doctor. So this is what
Yes.
we are doing, and I feel that once they attend these workshops, the transformation which I see, the confidence level, and I feel that it should be done on a very, very big scale. And I would really urge, I would like to use this platform for this. I would urge all the organizations and all the corporates also, they should be encouraging and conducting more of such kind of workshops for their women employees and the
Doctor, yeah,
examination.
thank you, Dr. Swati. That was absolutely, thank you so much for that information that you gave us. There's a question for you, Dr. Swati. Is it, do you recommend that women should get screened for the BRCA gene? That's Jacob Trevison from one of our viewers is asking you this question.
No, not for everyone. See,
Okay.
whenever there is any woman, any family member, be a mother or
Mm,
a sister, when anybody is detected with breast cancer,
mm,
we want to know whether this is a genetic trait which has been shared or which has been passed down to the other generation or to the same generation. For that, we call it BRCA genes. So
right,
then only generally for those only it is offered just to know.
right,
Like we all
right,
know the example of Angelina Jolie. She has
right,
the family history, and that's why she underwent a preventive
and-
surgery. So
right.
whether that would be an extreme step, but whether it is really required. So these tests are offered only to those family members in which family there's some other member has been detected with breast cancer, and if they are having this genetic predisposition.
Thank you. Thank you so much, Dr. Swati. If I may now request Dr. Prachi, please.
Yeah. So I think a lot of women who come to me, they talk about, they feel guilty, sometimes sad, sometimes depressed about their excess weight that they probably missed out after pregnancy,
Right,
without losing after pregnancy, or even at menopause. And I think body shaming is something that is really not healthy, and
right,
which is unfortunately a sad part of the society. But I have seen that. So basically, what women struggle with is their lifestyle. And also there is one traditional, kind of trend. The family has especially in the villages where the family have their meals first, and later uh, women has it.
right.
And that's how probably they get probably the nutrition level is low when they have when they suffer in their nutrition because of these kind of practices.
Mhm,
So um, so there are I have had clients like that. There was this lady who came to me
mm,
with for weight loss, and she had kind of stopped going to her mother's place, native place, for I think 2 years. She didn't go to her place because people used to call that, okay, your husband is so lean, and your daughter is so lean. Why are you so fat? So something
mm,
like that. People pass these kind of comments,
yeah,
and so when she lost weight, around 11 kgs of weight, and she had a lot of problems. Like she used to wake up in the midnight and had breathing problems, and all of that. And after 20 years of she had learned Bharatnatyam in the past, and after losing weight, she performed with her daughter on stage in an
lovely.
annual function, and she was so happy. So I
Yeah,
think these are the kind of moments that
yeah,
we look out for. And
yeah,
I think it's a bliss to witness these kind of moments. And my USP is to work on people's lifestyles, where
right,
I help with them, because it's not just a diet that I can just scribble and give them. Okay, you have to follow this. It doesn't never works out
right,
that
right.
way. Yeah. So
But this is where I'm just quickly going to ask you this, Dr. Prachi, since we are on the topic. We always see that our grandmoms and great grandmoms or grandmoms and all. Whatever happened, they had a much healthier life as compared to the kind of lives that we are leading. And of course, there are a whole lot of reasons which are there, due to that. But there are certain things is that in today's day and age, because of technology also, there's so much available today. That there is so much of extra knowledge that is available. That also can be very very harmful,
yes, you're
to
absolutely
people.
right.
And since you're into you're a dietitian, into nutritionist, and you look up every day. If you open the newspapers, you have something new coming up.
Yes, yes.
If you eat this, this is going to be great for you. If you follow this diet, this is going to be great for you. So a new term, a new word. So how does one deal with so much that is happening, doctor?
So there was this fat diet which came in between, which is called as keto diet, and
Yes.
I will just share an example of one friend of mine who wanted to lose weight, and
Right.
during the lockdown, what he tried was he stopped carbs completely, and
Right.
was only having those pulses and dal and all that, and eventually when he went to his physician, his uh, creatinine levels were high, and his doctor literally told him that if you're not going to stop this diet in the next 4 months or 3 to 4 months down the lane, your kidneys might go into permanent failure.
Failure. Yeah.
So,
Yeah.
so basically, I mean, it was very disturbing for me to know that because people lack awareness, that's why they
Yeah.
blindly follow these things
Yes.
and
Yes.
just jump into it. So one
Yeah.
must definitely seek their at least their family physicians or nutritionists
Oh,
or whoever they believe in,
yeah. Right. Right.
who have the authority to advise that particular, at least give us advice on that.
Thank you so much, Dr. Prachi. That was absolutely wonderful to know. Dr. Shilpa, can please maybe know your views.
Yeah, the woman health is the pioneer of men's health. I always say that if the woman is malnourished, it's a woman. And
Mm. Right,
so
right.
I feel woman wellness is one of the most basic criteria of human being. And
Mm,
as I'm wellness expert, but above that, I'm an experimental scientist. So
mm,
what I have seen in my during my PhD, what observation I've got throughout is that my gosh, it is so easy to keep women healthy, to have a healthy
mm,
generation. And why
mm,
are we not doing it? So
mm.
women need to be empowered with health, not only physically but mentally as well.
That's right.
So,
Yes.
when the woman is hurt, and woman is like a flower, and they should be emotionally treated well rather than the physically.
Mm,
And I don't know that how many work on this is theory, but we have a theory of human being is like that. The day then Adam had come, it is like that. The man is a sex oriented and woman is an emotional oriented. So we both need to be treated, and we both
right,
need to come in a balanced way. So
right.
if you say we in our wellness, we try to for the woman, because specifically you ask a question, what do you do
Mm,
for a woman? So
right.
we do underprivileged programs for the women also, where we make them understand how important your health for giving a healthy human being ahead. So that is number one, the program which we do. Then we do women hormonal balance programs, which is again menopause related, or their
Mm,
imbalance conditions physically and mentally both. So wellness treat
great.
them 360 degree holistically. So this is one
Right,
of thing, and as Prachi is there and Swati is there, they know that
right,
how this, like, breast cancer, what Swati is working for, that is also come out of eventually. Something doesn't come suddenly. So the
right.
woman should not be an ignorant of their daily pain. Woman should not be the ignorant of their deficiencies. So
Mm.
I as a woman also tell everybody, but then as a wellness expert, I say that please kindly women keep yourself healthy to give a healthy generation. And this is what I would like to preach from my center on the Women's Day.
Great. That's fantastic, Dr. Shilpa. What you said is absolutely correct. But I would like to ask you one more quick question. Is that you are extremely passionate about children's health, and
Yeah.
way back you had drawn out an amazing program for each and every child. Who, especially, it's something which can be done in schools at a very younger age, then lots can be done
Yes.
better. Then our each and every then our children, in the future, will have better health. So if you could kindly throw light on it, please.
Absolutely. Thank you so much, Suhani, for asking me this question.
Yeah.
Because my PhD is basically in school. I have done it on 5,000 children. And
Right.
in that was I think 10 years back, I can say. And at that time,
Right.
when the results have come that their SpO2 is so low, they are anemic and they are weak, and so multiple deficiencies they are having it. So I feel that, okay, are we in a right direction while giving them education and talking about the mental health with the children when they are physically not so healthy?
Mm,
So,
mm,
I made a program, even in my PhD also, the program was like that, that we have taken a 15 physiological parameter, which is easy: height, weight, BMR,
mm.
BMI, and then their SpO2, their lung function capacity. So I created a program of non-invasive diagnostic of the child, and with that
Right.
mental health inventory. So,
Right.
eventually, like in June, if I take out the physiological parameter and statistic, and then we chalk out a nutritional plan as per their age group: 5 to 7, 7 to 9, 9 to 12, and then we give
Mm-hmm.
it to the and then we do the workshop for the parents to make them understand what kind of children they have. And
Mm-hmm.
so eventually every 3 months we do this test again, so we understand end of the year what are the difference has been given to the child, and how the school has become the healthy school. And zero deficient. My goal is to, because the child is like a,
Absolutely.
a very blooming flower. Every day if you put water to
Yes.
them, they will bloom very differently. So school and the children is the only thing, and I think that is the best solution for our humankind also, to nurture them early.
Mm.
So school where the child grow mentally, they need to grow physically also in the school itself. It's not only the home, but it's school as well.
Thank you. Thank you
So this
so much, Dr. Shilpa. That was absolutely brilliant, because children are our future. And I think that's something which we really need to take care of, and really do something about, which is, and the program which you have done for them, I think, is brilliant. So it's really, truly my honor today with these three eminent doctors that I'm sitting here and moderating their panel. This is a moment, an unforgettable moment for me. Thank you so much, Dr. Swati Kshirsagar, the a woman who's known as the imaging for women, because that's what her center does. That's what Dr. Swati does. And she is there for all of us, and she was there for all women. So, Dr. Swati, if you could please quickly tell our viewers, if they have to connect with you or if they have to get in touch with you, how can they do that? Are you available on social media, or if you would like to share your email ID, please go ahead.
Sure. The name of the center, we are in Borivali. We are located in
Right.
Borivali West. Name
Right.
of the center is Precision Diagnostic Center, and you
Right.
can connect to us on number 9820493249. We have
Okay.
the email ID precisiondc.19@gmail.com.
Great. I hope everyone has taken note of it, because this is something which is really important. And Dr. Swati Kshirsagar is also present on social media. You can definitely connect with her. She's there on Instagram, she's there on Facebook. Do connect with her. And if you have, believe me, all women, I'm only not only talking about women, men, anyone, if you have any query, just feel free to message her, and she
Sure.
is there to support you. right? Dr. Prachi, if you could please go ahead and tell us how people can contact you if they want, they need your, if you could give your contact to everyone.
Yes. So thank you, Dr. Suhani. And my contact number is 9920354577. So you can call me or WhatsApp me on this number. You can also visit my blog, drprachiambolkar.co.in. And if you want to write to me, you can write at drprachiambolkar@gmail.com.
Right.
Thank you.
All the viewers who are watching, I know we know Dr. Prachi as a dietitian, a very well-known dietitian, top five in Navi Mumbai. But the life-saving skills program that she does, I think that's such an important thing. Till I met Dr. Prachi, I didn't even realize that it could be so much of an importance. There has been an incident where a person has actually dropped in front of us, and my husband who was there, he had to give him CPR. Now, if I was
Okay.
there, I wouldn't have managed it, but my
Right.
husband did because he knew.
Great. Great.
So I think every individual should know that, and this is also something I think all schools should hear. I hope they are hearing and listening. These are the skills which we should impart to our children, so that because as they are our future. Thank you, Dr.
Mhm.
Prachi. And Dr. Shilpa, please could you kindly tell our viewers if they have to get in touch with you, how they can. Dr. Shilpa, I think Dr. Shilpa is having a bit of an issue with her. Uh, Okay, Dr. Shilpa is available on Facebook as well as Instagram. She's there by her name, Dr. Shilpa Desai, and she's also there by C for Wellness. So please do connect with her, anything and everything related to wellness. And yes, all you mamas who are watching, if you want your children to have a know about your children's health better, the person to get in touch with is Dr. Shilpa Desai. Well, I would like all three of you all to give one parting message to our own tribe, the women. So, if we may start with Dr. Swati, please.
If you really want to keep your family to be in
Yeah,
good health
I can.
condition, first start with
Hello. Yeah, yeah, Dr. Swati, please go ahead.
Yeah,
uh,
Suhani.
Yeah, Dr. Shilpa, we're coming to you.
No,
One
I'm
second.
Shilpa.
Doc,
Can you hear me?
yeah, yeah, Dr. Shilpa. Yes, I can hear you. Just give us a second, Dr. Shilpa. We're coming to you. Just a second. Dr. Swati, please continue.
yeah, if you want to take good care of your family, first start taking good care of yourself.
Yeah. Okay, that's short and sweet, but it really is very powerful indeed. Dr. Prachi,
So yeah, happy International Women's Day to
नहीं
everyone.
नहीं I just
And yeah, like Dr. Swati said, it is the same message that if you eat healthy, the entire family will eat healthy. So and believe me, it's not difficult. Uh, Enjoy yourself and have a great day. Yeah.
great, fantastic. Dr. Shilpa, if we can you hear us now, Dr. Shilpa? Are
yeah
you
I
there?
can hear. Yeah, I can hear.
Yeah,
I can
yeah.
hear.
So,
Yes, I'm
Dr.
there.
Shilpa,
I'm there.
Dr. Shilpa, if you could first tell us how people can get in touch with you if they want to contact you, how can they do that? Can you please tell our viewers that?
Yeah. You can my number is 9820465528. My Instagram handle is C4Wellness, and Shilpa, Dr. Shilpa Desai Instagram handle is also there. Facebook is also on the C4 Integrated Wellness name and Shilpa Neerav Desai. So you can always connect me there. And definitely we would like to have you all and the share a wellness and give a happy life to everyone.
Yeah, great. Dr. Shilpa, your message to the women out there, to our women tribe.
Yeah, I would like to give a woman one message that the woman, your children are observing you. The observation makes a person what they become.
Right,
So just see to it that you give a right observation to your children, your people around you, and you exactly give that observation which you are. So, what
right,
happened? Your half of the stress will cut down, Your half of the time will be saved. Your
Right,
children will be automatically become the best the way you want them to be. So I think
right.
everything is all about feeling and seeing. So let's have a nice feeling and good seeing. So this is what I have to say.
Great. Thank you. Thank you so much. And this is me, Dr. Suhani Mendonsa, who's been uh, uh, the host and the moderator of today's panel. And from me, I would really like to say I have really met, seen, worked with so many women who have overcome everything that was meant to destroy them. And when I see such women, I feel so elated and so proud to know them. And it makes me feel even more, I take more pride in being a woman because the strength that they have is absolutely brilliant. So, on this note, I shall take. Yes, yes, Dr. Shilpa. Yes, Dr. Shilpa.
Suhani, you
Yeah.
ask each of us to talk about one line for Suhani. You have
Good
to.
one.
No,
Yeah. No, no, no. This I will moderate. This I will moderate. So kindly each one of no, because Suhani, you are also a woman. You are also part of
yeah,
this panel.
very much.
Absolutely, absolutely.
Thank you. You are very, very kind. Yeah, very, very, very
And
kind, Dr. Shilpa.
same, you are no, you are so fantastic giver, and I have learned from you and Mr. Mendonsa a lot in my life in this phase of the way we are passing through. So you guys are a very inspiring people. So definitely, woman can be like the giver, like Suhani. I would say she has given me good observation.
Thank you. Thank you so much.
So,
Very, very kind of you.
so thank you so much,
There's
Suhani.
I
Yeah.
will second Dr. Shilpa on this. I
thank you,
completely
Dr.
agree with
Swati.
Dr. Shilpa.
Thank you,
So,
Dr. Swati. Thank
an
you.
amazing host. Thank you so much, Dr. Suhani. And the melody, both in your voice and your singing.
Okay, that's great. Thank you so much. There's one person who I'd
So much for
really like to
having me.
thank today is Khushbu Chotalia. Khushbu, if you're here, please give us a wave or please message the lovely creative that she's made and everything that Khushbu does is like you just pick up the phone and call her and she's all there for you. So that's
Yes,
what Khushbu
absolutely.
Bhavesh Chotalia, who is the co-founder of Sanskari Decor, and she is the one point of contact who's always there for all of us. So it's such a wonderful. I mean, it's a pleasure working with her and being there. You know, in every event that we do together. So thank you so much, Khushbu, for your support, for being here and getting all these wonderful doctors and supporting us in this panel discussion that we've had today. And my parting words would just be please look after your health so that you can look after your family. Would definitely stress on that. And once again, before I leave, I'd like to tell everyone take care of yourself, stay safe, and be positive. And if there is anything worrying you, don't keep it within you. Please share it with a friend who you trust or your inner circle or your family member. But do share it because by sharing, you will reach a solution. But if you just keep it within you, it's just going to harm your health. And you never know the problem you're facing, someone else may be facing the same problem, right? Thank you once again. Heartfelt gratitude to all
Thank
you
you, Dr.
three
Suhani.
wonderful doctors who are doing amazing, amazing, amazing work. And all the very best
Thank you
in
so
all
much.
your future endeavors. On that
Thank
note,
you.
Suhani, for this
thank you.
wonderful
Thank
platform, and
Thank you
thank you
so
for
much.
thank you.
Thank you so much, Suhani. Thank you, Swati, Prachi. It was wonderful listening to
Yeah, it was
your
a
and
pleasure
women.
listening to both of
a
you.
special
You
mention
know,
of Team
and
InfluencerThon, without whom we wouldn't have been here today.
passion.
So thank you all of y'all. On that note, bye bye. God bless everyone. Have a
Look,
great
looking
week
forward to
ahead.
you.
And yes, happy International Women's
Women's
Day.
Day.
Let's say it together. Let's say it together. All of us say it together on the count of three. One, two,
Yeah.
three.
Two, three.
Happy
Happy
International
International
Women's Day.
Women's Day.
Okay. Bye bye. See you.
Bye.
Bye.
Dr. Suhani, your energy is always infectious, contagious. So we always go back with a huge positive energy.